My name is Deckert, and I'm here and I appreciate the opportunity to talk to you this afternoon and give you some highlights of the 2013 surveillance year for the CIPARS program, the Canadian Integrated Program for Antimicrobial Resistance Surveillance. So you may have heard of the CIPARS program in previous talks or in previous presentations. It is a national surveillance program coordinated by the Public Health Agency of Canada in collaboration with many other partners, federal, provincial, and within industry. We collect data about antimicrobial use and resistance in specific bacteria along the food chain as well as in people. The goal is to support the evaluation and creation of policies to contain AMR and to better manage AMU in both humans and animals. Here's a schematic of our current program, and we've got, oops, if I can make the pointer work. On the antimicrobial resistance side, there are both active and passive collection surveillance systems, as well as our components, and then we also collect antimicrobial use data in both people and animals as well. In a bit more detail about the antimicrobial resistance data sources, we have active surveillance at the farm, at abattoir, and at retail, and we collect clinical information on a variety of species as well. Our primary species of interest are cattle, chickens, pigs, turkeys, and obviously people. The bacteria we're primarily interested in are Salmonella, Campylobacter, and generic E. coli. And in this particular chart, the squares that are in yellow are ones that were added in 2013. The ones that are somewhat pale are the ones that we do not report data on. And so for turkeys, this is due to the fact that the turkey data at farm level is coming in collaboration with FoodNet Canada in British Columbia, and we don't report when we just have one province worth of data. The retail salmonella, the retail pork salmonella, the prevalence is low enough that we don't have a sufficient number of isolates to report the antimicrobial resistance information. The gaps that you see in the chart, so Campylobacter at retail pork and retail beef, and also Salmonella at abattoir in cattle and retail beef, we again don't report because the prevalence is low that it's not worthwhile to isolate those bacteria. The human data is case data from across, or case isolates from across Canada. The antimicrobial use data sources that we have, antimicrobial distribution in Canada is a very complex system, and there are many ways, or many spots along the distribution chain where we can collect data, or you could collect data. And for our purposes and in our system, the human data, we collect, we have pharmacy dispensation data and hospital purchases that are more national and quantity of antimicrobial used. And then we have closer to the end user, physician diagnosis and antimicrobial recommendations, which gives us more information on why things are used, who they're being used on, and that type of thing. On the animal side, and that data, is all purchased from the IMS Health Canada, Inc. On the animal side, at the national level, we have kilograms of antimicrobials distributed for use, and that information is provided to us voluntarily by the Canadian Animal Health Institute, which is a coalition of animal health companies. We also collect end-user data through a farm questionnaire of grower-finisher pigs, and grower-finisher pigs are the final stage of production for pigs, as well as broiler chickens, and that data is voluntarily provided by participating veterinarians and producers. So when we take all that data that we've collected on antimicrobial resistance and antimicrobial use, we look at it all individually, at each component and host species and bacterial genus separately, and then that's all combined and looked at together, and we look for trends and issues of interest. The highlights that I'm going to present to you today represent a starting point and potential associations and are certainly not causal. We conduct further investigation and additional analysis to better understand the issues that we see when we look at the data altogether. So the highlights that I'm going to present this afternoon are the highlights of the highlights, so I had to pick and choose. Our data is reported in a chapter format, so we have a chapter 1, which is our methods. Chapter 2 is our antimicrobial resistance data. Chapter 3 is the animal antimicrobial use data, and chapter 4 is our integrated chapter, where we attempt to bring it all together and look for issues that cross various boundaries. So Chapter 1 and 2 for 2013 are currently on our website, and our website will appear at the end. We anticipate that Chapters 3 and 4 will be out by the end of the summer. And at the end of November, or the beginning of November, we'll have our stakeholder meeting, and I have information on that, which will have 2014 highlights. I should mention, too, the antimicrobial use data on the human side comes out in a separate report that you can also find on the website. So starting with some antimicrobial use information, integrating the knowledge of both populations and the use of antimicrobials at a high level. And so in this particular graph, we've got the population here on the, of animals and people on the left axis, and that's the blue bars here. And then the red dots are the kilograms of antimicrobials distributed or sold, and that correlates to the right-hand axis. And so we can see that there's a lot more animals than people. In fact, there's 18 times more animals than people in Canada. And there's 4 times more antimicrobials distributed or sold for animals than there are for people. When we adjust that for the populations and for the weights of animals and people, you can we have 1.4 times more antimicrobials that are used in animals than in people, or distributed and sold for animals than for people. The other thing to note is that 32% of the total kilograms of antimicrobials distributed on the animal side are in drug classes that are not used in human medicine, things like ionophores and chemical coccidiostats, and they are not included in this particular graph. This data also does not include antimicrobials that are brought in under some certain specific conditions, own use importation and active pharmaceutical ingredients that are not captured by the Canadian Animal Health Institute data. That's about 13%, but that's very much an estimate. When we look at the classes of antimicrobials used, you can also see some differences between people and animals. So on the left we have humans, on the right we have the animals, and the primary class or the predominant classes used in people are beta-lactams, cephalosporins, fluoroquinolones, and macrolides, whereas on the animal side we've included the tetracyclines are predominant, and the ionophores and chemical coccidiostats are also very predominant, followed by other antimicrobials and beta-lactams. When we look at that, break that down a little bit more, although there's similar products, they are distributed differently in different sectors. And so on the left-hand graphic here, we're looking at cephalosporins and fluoroquinolones. Cephalosporins green, fluoroquinolones red. And at the top bar is animal production, and so that includes food animals and horses. And companion animals is the next set of bars, human hospitals and human community pharmacies. And so we can see that 46 times more fluoroquinolones and 11 times more cephalosporins are distributed for use in people versus animals. When we look at tetracyclines and macrolides, that flips. And you can see, again, we've got the production animals, companion animals where there is no use of macrolides and tetracyclines. And same with human hospital purchases. We don't see those antimicrobials used. And then there is a little bit in the human side from community pharmacies. And so we have 5 times more macrolides and 79 times more tetracyclines that are used in animals versus people. When we drill down even farther and look, okay, within food animals, there's differences as well in the classes that are used. So when we look at feed, because that's the primary way that antimicrobials are delivered to pigs and chicken, when we look at pigs on the left-hand side and broiler chicken on the right-hand side, you can see that the antimicrobials used, again, differ substantially. So with pigs, it's tetracyclines, macrolides, lincosamides, and ionophores, whereas with broiler chickens, it's ionophores and chemical coccidiostats, bacitracins, and streptogramins. So again, we have substantial differences between the species in the antimicrobial classes that are used. When we look at reasons for use, and this is the advantages of the data sources that are closer to the end user, it allows us to capture some of this type of information. You see when we look at this, the green bar is 2007, and we down to the purple bar in 2013. Fairly consistent. Most of these conditions that physicians are recommending antimicrobials for are respiratory tract conditions and urinary tract infections. And so it's quite consistent over time. Those are the predominant reasons for antimicrobial prescribing. When we look at reasons for use from our questionnaire data, from our farm data, from broiler chickens and swine, again, the reasons for use are different to some extent, but the disease prevention is the primary reason for use in both chickens and in swine. And predominantly in chickens, that would be for respiratory tract infections, and in swine, it would be for enteric and respiratory. You can also see on here on the right-hand side, we've got over the 5 years of the program, 2009 to 2013, the blue being treatment, red prevention, and green is production claims. And we can see that there does seem to be an increase in the percentage that's used for treatment and a bit of a decrease in the percentage that's used for prevention. So we'll see how that tracks out over time. So switching gears a bit to Campylobacter. As you know, Campylobacter is a very common cause of bacterial gastroenteritis in Canada, with over 10,000 cases reported in 2012. Most human cases are caused by Campylobacter jejuni. When we look at what we've recovered with respect to Campylobacter from our samples, you can see that chicken ranges from 20 to 30% across the spectrum from farm to retail. And it's very common as well in pigs and cattle at abattoir, and 12% in turkeys. And what we can say is that primarily in chicken, cattle, and turkey, that is Campylobacter jejuni overwhelmingly. In pigs, it's overwhelmingly Campylobacter coli. The other thing you'll note, again, we don't have any Campylobacter in retail pork or beef because the prevalence is so low that it's not useful to attempt to isolate that. Ciprofloxacin resistance is one of the issues that we're concerned about with respect to Campylobacter. Enrofloxacin and danofloxacin are two fluoroquinolones that are approved for use in cattle and pigs. Ciprofloxacin is obviously used extensively in people, and the concern with resistance is that it may result in more severe illness and may also have resistance persist in the absence of selection pressure. So that's certainly a concern. Retail to farm, when we look at the percentage of isolates, Campylobacter isolates that are resistant to ciprofloxacin, ranges from 11 to 20 in chicken, 13 in abattoir and pigs, 5 in cattle, and 16% in turkey. The concern with this 14% is that it is an increase from 7% in 2012. When we look at this data on a regional basis, it becomes even more interesting. Resistance to ciprofloxacin and Campylobacter is highest in British Columbia, and there was a notable increase among the isolates from retail chicken. There's also somewhat of an increase in abattoir chicken and in retail turkey. When we looked at our use data for broiler chickens, the only province that reported using antimicrobial or fluoroquinolones in broiler chickens was British Columbia. However, that is 1 year's worth of data, and so it's insufficient to draw conclusions, but it's certainly something we'll be monitoring. The unfortunate thing with Campylobacter is that we don't have any human AMR data to compare to in order to assess the burden of illness due to resistant infections and to look at regional differences from that perspective. Switching to Salmonella Enteritidis, on the left-hand side here, we've got the cases per 100,000 inhabitant years, and that's the blue line, the human incidence. The green line is the percent Salmonella in retail chicken, and these are the different regions that we collect retail chicken data on. And there's no Maritimes data for 2012, 2013 for retail chicken for a variety of reasons. But you can see that there's an apparent visual correlation between the retail chicken data and the human incidence data. One of the interesting points is that 100% of our agri-food isolates of Salmonella Enteritidis are completely susceptible. There are about 17% of human isolates that are resistant, and these are probably more due to imported food or travel, because we certainly don't see any evidence of resistance in our domestic agri-food isolates. Salmonella Dublin in humans and cattle. This is a very small number of isolates, but it's something that we're keeping an eye on. Human cases, we have 8 isolates, 4 of them from Quebec, and all 4 of those are multi-class resistant, and all of them carry the CMY2 gene. Cattle clinical isolates, and that's the only place we get Salmonella in cattle. We have 13 of 56 isolates that were resistant to 6 classes, and 55 of those came from Quebec as well. Whole genome sequencing of these isolates differentiated the multi-class resistant from the susceptible, and the multi-class resistant cattle and human ones seem to cluster together. And additional molecular analysis is ongoing. It's something we're keeping an eye on. So some final key messages: antimicrobial use. It does differ between people and animals. Many of the same drugs are used, but the relative amounts vary. And human use is for treatment of respiratory conditions and urinary tract infections, whereas in grower finisher swine and broiler chicken, the use is primarily for enteric and respiratory disease prevention. Antimicrobial resistance, we're keeping an eye on things like ciprofloxacin resistance in Campylobacter, the changing regional patterns that we see. Salmonella Enteritidis, the apparent correlation between human incidence and retail chicken, and Salmonella Dublin, the potential relationship between human isolates and clinical cattle. Certainly like to acknowledge the many people who are involved in the ongoing operations and data provision for the CIPARS program. As you can see, they're quite extensive, and without them we really wouldn't have our program. So very appreciative of all that contribution and collaboration. This is, as I promised, this is the information on a multi-stakeholder meeting. Anyone who's interested in participating in that webinar, please contact us and we'd be happy to add you to the list. And again, that will be the highlights of our 2014 results. And with that, I'd be happy to answer any questions, and our website's on the bottom in English or French. Thank you.
Sorry, Anne and group, but I've received a message that we need to wrap up our questions and head over to the other room. So unfortunately, we won't have. Oh, they're coming here. Oh. Okay. So there's time for questions.
Stall for us.
Does anybody have any questions for Anne?
No. Oh, yep.
Why you don't have data from cattle or from cattle and dairy farms? Why do you have those end user data? You are usually using chicken and swine.
Oh, why don't we have end user data from cattle?
Yeah.
It's something that's in development, but it isn't undergoing. It is underway at this point in time. So we're working on feedlot cattle, but that it's just a question of getting it up and going. So there's veterinarians that are interested in participating, and yeah, we'd like to have feedlot cattle down the road. Absolutely, yeah. Okay, thank you very much.
Thank you.